Language access using interpretation and translation services. Funded and partnered with Indiana University School of Medicine and Indiana Family to Family. Effective communication is critical to ensuring understanding, empowering patients, and providing high quality care. A language access plan can help ensure that an organization provides high quality and appropriate language services. A language access plan can also help ensure that an organization's staff members are aware of what to do when an individual with limited English proficiency needs assistance. Language is fundamental to our connection with one another. Communication is key to taking part in society and in public processes. Ensures that limited English proficient individuals have equal access to services and opportunities. Helps ensure that an organization provides high quality and appropriate language services. Reduces barriers and promotes inclusivity. Can create continuity of care, increase efficiency, and improve patient and provider communication, and ultimately patient outcomes. A language access plan can help ensure that an organization provides high quality and appropriate language services. A language access plan can also help ensure that an organization's staff members are aware of what to do when an individual with limited English proficiency needs assistance. Your rights, language access, and health and human services. The U.S. Department of Health and Human Services, HHS, believes that everyone should be treated fairly and with respect. The HHS Office for Civil Rights, OCR, enforces laws that protect you against discrimination in health and human services based on your race, color, national origin, sex, age, religion, and disability. Limited English proficient (LEP) language barriers can pose significant obstacles to integrating into American society and accessing essential public services and institutions such as schools, healthcare, police and fire departments, and the legal system. Due to the serious civil rights concerns associated with limited English proficient individuals being unable to access public services based solely on their language, federal law requires steps to ensure language access. Language is the key to a person's self-identity. It enables people to express emotions, share feelings, tell stories, and convey complex messages and knowledge. Language is the most excellent mediator that allows us to relate to and understand each other. Language matters. Language is the thread that holds together our shared human experience. We all have a responsibility to help people access the information that impacts their lives and ensure they can engage using the languages they know best. As English and Spanish speakers, we are at an advantage when accessing critical information and acquiring new knowledge in the United States. We are far more likely to benefit from content that we can easily understand. Language help for everyone. You cannot be left out, denied benefits, or discriminated against by any healthcare provider, such as doctors, nurses, hospitals, clinics, or social services. You have the right to receive healthcare in person or remotely, including telehealth, websites, and mobile apps free from discrimination. Your healthcare providers need to make sure they can communicate with you in a way that you can understand them when you need their care or services. If you or someone with you doesn't speak English well or can't read, write, speak, or understand English well, you can get help with in-language services like interpretation or translation for free from your healthcare provider. You are not required to bring your own interpreter, pay for an interpreter, or rely on a child or family member to interpret for you. If you have disability, you can get If you have a disability, you can get tools and services called auxiliary aids and services to help you understand information for free from your healthcare provider. Americans with Disabilities Act, ADA, is a federal civil rights law that prohibits discrimination against people with disabilities in everyday activities. The ADA prohibits discrimination on the basis of disability, just as other civil rights laws prohibit discrimination on the basis of race, color, sex, national origin, age, and religion. The ADA guarantees that people with disabilities have the same opportunities as everyone else to enjoy employment opportunities, purchase goods and services, and participate in state and local government programs. Title VI, Civil Rights Act of 1964. Title VI prohibits discrimination based on race, color, or national origin in any program or activity that receives federal funds or other federal financial assistance. Programs that receive federal funds cannot distinguish among individuals based on race, color, or national origin, either directly or indirectly, in the types, quantity, quality, or timeliness of program services, aids, or benefits they provide or how they provide them. No Child Left Behind Act of 2001. Title III ensures that limited English proficient (LEP) students, including immigrant children and youth, attain English proficiency and meet the same challenging academic content and achievement standards that other students are expected to meet. Individuals with Disabilities Education Act, IDEA. The Individuals with Disabilities Education Act, IDEA, is a law that makes available free appropriate public education to eligible children with disabilities throughout the nation and ensures special education and related services to those children. The IDEA governs how states and public agencies provide early intervention, special education, and related services. Plain language is a powerful tool. The proper use of plain language empowers patients to engage in their healthcare, participate in shared decision making, be more compliant with treatment plans, and make informed medical decisions. How to communicate more clearly. Education, language, culture, access to resources, and age are all factors that affect an individual's health skills. People who do not read or write well struggle with communicating or understanding verbal communications about health, speak a different language, or have trouble understanding or using numbers, lack proficient health literacy. Someone who is sick, under stress, or in an unfamiliar situation will have a harder time processing and retaining new information. The principles of plain language focus on communication, both verbal and written, that is clear, concise, and logically organized. The goal is to communicate information in such a way that patients can understand it the first time they read it or hear it. In written communications, plain language should ensure that readers can find what they need, understand what they find, and use what they find to meet their needs. Mastering plain language. In healthcare, using plain language can be a challenge because medical terminology and acronyms tend to prevail. With some effort and practice, healthcare providers can incorporate plain language into daily practice. The following tips can help you communicate more clearly with patients using plain language principles. Know the audience. Language that is plain to some people may not be plain to others. That's why it's important to take your patient's current level of knowledge into account. Plain language is not dumbing down your message or talking down to a patient. It is communicating in a clear way that tells the patients exactly what they need to know without using unnecessary words or expressions. Use simple language. Choose words that are simple and familiar to make your message easier for people to understand. Limit jargon and avoid using acronyms. Be sure to define any medical or technical terms you use. Be concise. It's important to limit the amount of information you provide at any one time. Too much, too fast can be intimidating and overwhelming to patients. Being concise means focusing on what your patients need to know and do. Avoid details that would be considered nice to know. Organize the information. A key element of plain language communication is to provide the most important information first. This is where you would share what actions to take and why they are crucial. Also, breaking complex information into understandable chunks will provide clarity. Use visual aids. Research suggests that plain language combined with graphics and other visuals can help patients understand and retain complex medical information. Using visual aids, such as videos, as part of your interaction with patients enhances engagement and shared decision making. Visual aids should be chosen carefully to ensure they are high quality, adhere to plain language principles, and should be culturally relevant to your audience. Make it actionable and personal. Patients need to know how to act on the information they receive. Use an active voice to clearly state the actions you want your patients to take. Active voice is where the subject does the action. For example, instead of saying, once the inhaler is used, say, use your inhaler. It is preferable to highlight the positive by telling a patient what he should do rather than should not do. For example, say, take this medication with food, instead of, do not take your medication on an empty stomach. It is also effective to personalize your message by using second person pronouns. That means referring to a patient as you rather than speaking to them in third person as the patient. When health information is delivered in a clear, engaging, and personally relevant manner, it promotes understanding, engagement, and self empowerment for patients. Importance of cultural sensitivity. Becoming a culturally sensitive healthcare provider should be of utmost importance to all healthcare professionals. In a multicultural society like ours, you'll be rendering care to patients from diverse backgrounds, each with their unique cultural contexts, beliefs, and healthcare expectations. Understanding and respecting these differences is not just about being considerate or polite, it is in fact an essential aspect of providing effective nursing care. Effective communication. Cultural sensitivity is strongly linked to language and communication. Not gold, your patients may speak English as their first language. Even for those who do, there might be cultural differences that influence how they communicate about symptoms, pain, and other healthcare related issues. For example, some cultures may view expressing pain as a sign of weakness, which might lead to underreporting of pain symptoms. If you are not aware and sensitive to such cultural nuances, you might overlook the real severity of the patient's condition, making accurate diagnosis and appropriate treatment difficult. Building trust. Good patient doctor relationships are built on trust. When a patient sees that you are understanding and respectful of their culture, it helps establish that trust. This in turn makes them more likely to adhere to medical treatments, participate in decision making about their health care, and openly share any health concerns with you. Achieving better health outcomes. Ultimately, cultural sensitivity in nursing contributes significantly to achieving better health outcomes for patients. Studies have shown that culturally sensitive healthcare, which takes into account the patient's culture, language, and health beliefs, results in better adherence to treatment, fewer medical errors, and greater patient satisfaction. Patient education materials in multiple languages. Providing patient education materials in multiple languages is an essential step to gaining a wider reach and better understanding of the patients you serve. Multiple language needs. Many healthcare providers work in diverse communities where patients speak multiple languages apart from English. Providing clear and accurate health information in a patient's primary language facilitates better comprehension, an aspect key to patient centered care. It allows them to engage fully in their care, ask necessary questions, and develop a deeper level of trust with their healthcare providers. Translated materials. One way of comprehending patient education material is to provide them in local languages. Depending on your patient population, have your informational leaflets, guides, and handouts translated into the most frequent spoken languages. Make sure the translation is not just word for word. It has to be culturally appropriate and tailored to the patient's reading level. Keep in mind it's not just about understanding words. The context, culture, and literacy levels also play key roles. Consult a professional translator or utilize trusted translation services to ensure your content is accurate and effective. Be sure there's a system in place for giving out the right materials to respective patients. Visual aids. Not all patients may be literate or prefer written information. Including visual aids can be an effective strategy for communicating important health information. Simple diagrams and pictures can support your translated text and make the information more understandable for all ages and literacy levels. Digital resources. In the age of technology, having resources available online in various languages is also crucial. An online resource center allows patients and their families to access all the vital information at their convenience and comfort. Your ultimate goal is to ensure every patient has a full understanding of their care and treatment. Always be open to feedback and look for ways to improve and adapt your education materials to better serve your diverse patient population. Patience. Communication difficulties can be frustrating for you and your patient. Remain patient, speak slowly and clearly, and be prepared to repeat yourself if necessary. Your patient will appreciate your efforts. By incorporating these techniques, you can ensure effective communication with your non English speaking patients, providing them with the quality care they deserve. Remember, every technique may not work for every patient, so being adaptable is key. Differences between translation and interpretation. In our increasingly interconnected world, the ability to bridge linguistic gaps is crucial for effective communication across borders and cultures. Two professions that often come to the forefront in this endeavor are translation and interpretation. Though both serve the purpose of converting one language into another, they are fundamentally distinct processes. Here are the key differences between interpretation and translation. Medium of expression. The most fundamental difference between interpretation and translation lies in the medium of expression. Translation primarily involves the conversion of written text from one language to another. Translators work with documents, books, websites, and other written materials. Their task is to meticulously analyze the source text, grasp its context, and create an equivalent text in the target language. Translators have the advantage of time to research, revise, and ensure the accuracy and faithfulness of their work. Interpretation, on the other hand, focuses on spoken language. Interpreters listen to a speaker delivering a message in one language and convey that message in real time in another language. This demands quick thinking, exceptional listening skills, and the ability to capture the essence of the spoken words without the luxury of revision. Timing and context. The element of timing and context plays a pivotal role in distinguishing between interpretation and translation. Translators operate with a slower, more deliberate pace. They have the opportunity to carefully consider the context, conduct research, and consult reference materials to ensure accuracy and clarity. This extended time frame allows for meticulous work, but also requires a different set of organizational skills to manage large projects effectively. Interpretation occurs in real time, allowing no margin for revisions or corrections. Interpreters must quickly grasp the speaker's message, understand the context, and deliver it fluently and coherently in the target language. This demands not only linguistic proficiency, but also adaptability and quick thinking to navigate various communication contexts effectively. Accuracy and precision. Both translation and interpretation require a high degree of accuracy, but their goals regarding precision differ. Translators strive for a meticulous level of precision and faithfulness to the source text. They have the luxury of time to carefully select words, phrases, and sentence structures that accurately convey the original meaning. However, this can sometimes result in translations that, while accurate, may sound less natural in the target language. Interpreters prioritize conveying the speaker's intended meaning promptly and fluently. While accuracy remains paramount, interpreters may need to make on the spot decisions regarding word choice and sentence structure to ensure the message is understood by the audience. This can sometimes lead to a trade off between precision and fluency. Specialization and subject knowledge. Both translation and interpretation may require specialization in various fields, but the focus of expertise differs. Translators often specialize in specific subject areas such as legal, medical, technical, or literary translation. This specialization demands in-depth knowledge of the subject matter and relevant terminology. Translators have the time to conduct research and consult experts, ensuring the accuracy of their translations. Interpreters in settings like conferences or legal proceedings also benefit from subject knowledge, but must rely more on their general language skills and the ability to adapt to various contexts. They may not have the luxury of researching specific terminology during a live interpretation. Preparation and resources. The degree of preparation and the resources available to translators and interpreters vary significantly. Translators have access to various tools and resources, including dictionaries, translation memory software, and reference materials. They can take their time to research and consult resources, contributing to a more controlled and thorough process. Interpreters primarily rely on their linguistic abilities and memory during interpretation. While they may have access to some reference materials, the real-time nature of interpretation limits their ability to pause and consult resources extensively. Advantages of types of interpretation services. In person, interpretation is done face to face in the location where they are. For example, can be a customer, patient, member, employee, etc., and the organization's representative are both located. Sessions are usually booked in advance. Over the phone, the interpreter serves as the bridge during a telephone conversation between customer and representative. Wait times to connect to an interpreter are usually within seconds, which makes this solution ideal for on-demand needs. Video, virtual, remote. The interpreter, customer, and representative use video conferencing technology to communicate. This solution bridges the gap between in-person and over the phone. It can be effective in communicating with the deaf and hearing impaired. Your best choice, in-person interpreting services. Generally, in-person or on-site interpreting is the most effective as interpreters can read nonverbal cues. Body language and facial expressions are known to comprise a significant portion of communication. When it comes situations when an in-person interpreter is not available or when an on-site interpreting session is not practical, virtual interpreting services are a viable solution. Cost considerations apply to interpreting services as well. In-person interpreting almost always entails higher costs since professional interpreters may need to travel. Professional interpreters, your key to success in critical situations. No matter which interpreting service is preferred, it is essential to use the services of a professional interpreter. Professionals have the right training and adhere to proper ethics, confidentiality, and culturally appropriate communication, ensuring high quality interpreting and better results. This is especially important in sensitive and critical situations, such as healthcare or legal settings. Disadvantages: types of interpretation services. Translation and interpretation looks different in one setting compared to another. Different media promotes or limits understanding of different emotions, tone, and other nonverbal communication. In person, emotional connections are easier to sense, body language is easier to read, a shared setting provides limits distractions. Over the phone, communication is limited to the words being spoken. Distractions are more likely for all involved. The limits to technology need strong signal, waiting periods, and comfort in asking questions. Video virtual remote requires a strong and reliable Wi-Fi connection. More emotional connection incorporates some nonverbal communication and body language. Professional interpretation best practice. Professional certification. Certified translators and interpreters undergo rigorous training and testing to ensure their language skills are impeccable. They possess a deep understanding of linguistic nuances, cultural context, and specialized terminology, guaranteeing accurate and precise translations and interpretations. Certification demonstrates a commitment to the highest standards of professionalism and ethics. Certified translators and interpreters adhere to a strict code of conduct, ensuring confidentiality and the highest level of service. Higher quality of care. Using family members or friends as interpreters may compromise the quality of care due to lack of specialized skills and knowledge. Someone who understands complex terminology in a medical setting, for example, is more likely to choose the right words. Mistakes made by friends or relatives could lead to incorrect diagnosis or other issues. Children should not be used as interpreters. Confidentiality laws. Certified medical interpreters have to be HIPAA compliant, which means they have to keep your medical information private, just like your healthcare provider does. Interpreters follow a professional code of ethics that includes maintaining confidentiality. They are trained to handle sensitive information discreetly. Many legal and official processes require certified translations or interpreting. Using a certified professional can help ensure your documents are accepted by government authorities, courts, and other institutions. It's possible that patients won't disclose all relevant information through a family member because they don't feel comfortable sharing personal details or where there are safeguarding concerns about the patient. Friends, relatives, or children may withhold or alter information due to emotional involvement. Additional services. Successful cross-linguistic communication requires an awareness of the subtle differences between translation and interpretation. By understanding each activity's distinct purposes and nuances, individuals and organizations may navigate language barriers more quickly and precisely. Choosing the right method guarantees that messages are correctly communicated and understood across linguistic and cultural barriers. Whether written documents need to be translated or vocal communication has to be interpreted in real time. Understanding the differences between translation and interpretation gives us the tools to overcome the difficulties that come with communicating across languages, ultimately leading to the development of more meaningful and transparent interactions in our increasingly interconnected world. INF2F, Indiana Family to Family, Family Voices, and other organizations can help with communication and advocacy with providers and medical professionals when more support or resources are necessary. Stay informed, request copies of language access policies for providers in your preferred language. For more information, you can be in contact with Indiana Legal Services. Refusal to provide an interpreter constitutes a violation of rights, and you can report to Indiana Civil Rights Commission by phone at 317-232-2600 or online at the website on your screen.